They're on the front lines giving everything they have to treat the massive influx of critically ill patients. But just outside hospitals across the country, especially here in California, nurses are also making their voices heard.
It's wrong.
Members of National Nurses United say the CDC has rolled back personal protective equipment standards, which the medical facilities they work for have been quick to follow. For nurses, that means ordinary surgical masks are the norm, with higher quality N95 respirator masks hard to get and sometimes only available upon special requests from management.
One of the greatest challenges we're experiencing in the non-ICU setting is people who have a fever and a cough. They haven't been ruled out for COVID-19. The nurses take care of them for 2 or 3 days, and then the doctor's saying, oh, let's just check. And then the nurses are furious.
At the end of the day, all of this social distancing, means nothing when it comes to infection control if the people at the bedside of the ones who are infected the most are not protected. And then we go to other patients we care for who may not be COVID patients, who now we're transmitting the disease to them. We are, by virtue of our roles, designed to be super spreaders. And if we do not have the appropriate PPE, then that is exactly what we're doing every day, every shift, to every patient, to their families. We go home to our families.
The nurses say in many cases they also have not received enough training to deal with COVID-19 patients. California Governor Gavin Newsom also recently loosened staffing ratio regulations, meaning nurses will be handling more patients at one time. To combat a nursing and medical staff shortage, Governor Newsom also put out a call to health professionals who've recently retired and to nursing students, asking them to sign up for the state's new health corps. 25,000 people signed up in a single day.
I'm very curious about what that looks like and how people with some medical background can then serve these patients, all the while staying safe. If you're not able to provide us with above average personal protective equipment, how are you protecting these retired people or these students?
We chose this profession because we love to make a difference. It is who we are. We go to it. We want to heal. We want to make a dent in the problems and make them go away. So no matter what, we are going to do whatever it takes, to save a life, to heal them, to make a difference. And so because of that, because we know our nature, it does not help when we don't have the tools to do that.
Everybody in, nobody out.
As protests continue, so does work. The demonstrations all take place during their shift breaks before the nurses once again head back to serve their patients. Mark New, CGTN, San Francisco.